Can you switch acne off and on? That's the question that we're going to answer today. Welcome, I'm Dr. Arthur Kolsky. I'm founder and medical director of Advanced Acne Institute, and we are a dermatology practice that only treats acne, so we like to offer insights to help acne sufferers navigate the path toward clear skin. However, we offer our insights as educational opportunities only, and this is not meant to be medical advice. Can you switch acne off and on? So that's a question that I think is important to understand when we're talking about how to treat acne. So one of the things that I tell my patients at Advanced Acne Institute is that if you want to choose a treatment that's going to be the most effective, you want to use a treatment that gets to the root of the problem. A lot of the treatments that we have are more like Band-Aids, and they might help to some degree, but that usually involves covering up the main problem. So is there a switch, an actual switch that we turn on and off that we can use to help treat acne and stop acne from happening? So the way I talk about this with my patients is that I draw a diagram on the board of what's inside of an acne-prone pore. And if you look with a microscope inside of an acne-prone pore, you'll see a structure where you have a hair follicle and an oil gland. And they come together, they attach, and that structure is where acne forms. And the way acne forms, the first step is hormones, together with other factors, but especially hormones, they switch on the oil gland. Certain hormones that are circulating in our bodies that are derived from testosterone, they switch on the oil gland. They stimulate the oil gland to become active. And the oil gland begins to produce oil, and the oil makes its way out through the pore onto the skin surface, and we feel oily, and that's normal because our skin needs to feel moist and hydrated in order to be healthy. But when we have acne, those hormones might become too active. For example, when we're a teenager, our hormones peak at their highest levels of our whole lives. But those hormones may become active for different reasons as well. Or our oil glands might become more sensitive to those hormones. So when that happens, the oil gland becomes super active and it begins to make too much oil. And it also begins to get closed off at the opening where it opens onto the skin surface. And a lot of things change and bacteria begin to grow and inflammation sets in and then a pimple develops. So if we're going to stop that from happening, well, we could use things that kill bacteria, but that's not really turning off the process because we still have the hormones activating the oil gland, switching it on. We could use things that take away inflammation, but we still have the switch turning on the oil gland. We could use things that help unclog the pore, but we still have the switch turning on the oil gland. So unless we use something that's going to get right down into the place where the switch is turning on the oil gland and turning off the switch, essentially, we're never going to stop the process from happening. So when I talk to my patients, I discuss the different types of medicines, and I discuss the ones that can get to the switch and turn it off. And there are ways of doing that. With different medicines work in different ways. But unless we get to one of those medicines, we're going to have a hard time controlling acne for the long term. So the idea is if we're going to get in control of our acne, we want to do something at the root of the problem. We want to get right where the switch is turning on the whole process of acne formation and stop it right in its tracks.